Hey everyone, welcome to our live event with MDPen. I'm Alexandra, and today I wanted to talk about getting hands-on with the microneedling device and just going over some basic safety, especially if you're a first-time user or if you've, let's say, brought microneedling into your practice in the last year or so. There's definitely things that you want to know. As always, please feel free to ask questions in the comments. So when it comes to the MDPen microneedling device, or basically any microneedling device, if you're a first-time user, it's definitely worth it to seek out training. MDPen does offer hands-on training. This consists of a very knowledgeable educator with experience coming to your practice and training you and your staff with live treatment models. So I definitely recommend this. For many estheticians, microneedling is the first treatment that they're learning after graduating that involves bleeding. So yes, even though you take, certifications and learn about blood disorders and everything like that in school, it's still really important that you go about microneedling, with a basic different safety protocol. There's a lot of other things to concern when you're doing this treatment, and you want to be confident, with something that can cause pinpoint bleeding, and make sure that you are, being the safest you can for yourself and your patient. This is definitely a treatment where you should be wearing gloves. They don't have to be sterile surgical gloves, but they need to be, clean, fresh set gloves and everything like this. So as I said in yesterday's video, when you're prepping the skin for microneedling, you definitely want to be doing a full cleanse. When you go to remove the numbing, make sure you are cleansing, not just wiping. After that, you want to use alcohol. This is a safety measure. You don't need to use acetone. You don't really want to use acetone. I know there's peels that call for acetone prior, but that is not necessary. With microneedling, you want to just do alcohol, which can be on a 4x4 or a medicated alcohol wipe. And then at MDPen, we do have you go in with the copper HA mist product there as part of the protocol and safety for the procedure. This is going to have great antimicrobial properties and help calm and hydrate the skin as you needle. The HA in here is going to be a nanoparticle, so it's going to reach the skin and hydrate immediately upon that misting application. Here's a direct link for that there. Now, once you've misted the skin, typically this is when you're going to apply your needle cartridge. Maybe you did it while they were numbing. That's also okay. Although I don't always recommend, if you are leaving the room, to leave your sharps, next to the patient. You also don't want it to be like intimidating for them to be, you don't want it to scare them. So you don't have to put it on the tray right next to them, but these are single one-time uses. And when you're taking this out, it's best that you actually break the package. So you want to pull the package apart, basically. You don't want to just shove the back of the needle through the paper and take it out that way. So make sure you're opening it properly onto your treatment area, which doesn't need to be entirely sterile, but it should be clean, of course. And when you're attaching a microneedling cartridge, if you haven't been, I guess I'll say, trained properly, a lot of people will hold the pen towards themselves and look into the barrel as they're applying the needle cartridge. You don't need to do that. A good cartridge is going to line up with the device, and you definitely don't want to be, turning it on with it facing you or facing the patient if you're not absolutely certain that you've locked that needle in place. So this is something safety-wise that we want you to be extremely comfortable with at MDPen. It's not difficult once you've done it, but it is important to know the proper way to apply the needle cartridge and make sure that it's locked in place. You don't want it to go flying off the device if you did not apply it properly. So same thing goes for removing the needle cartridge. You want to have gloves on because you've done a treatment. There could be, blood on there, there's serum. And when you go to remove the cartridge with MDPen, you're twisting counterclockwise and just lifting right off. And that needs to go straight into the sharps container. That's very important as well. When it comes to safety and cleaning your device, you have multiple options. This is based on your own preferences. This is based on your medical director. You do want to be fully cleaning and wiping down your device. You want to use something that kills everything, all germs, all viruses, all bacteria. Cavicide wipes can be great if you'd rather spray the cavicide onto a 4x4 or paper towel. You could do it that way, but they do have, pre-packaged wipes. And when you're cleaning your pen, you don't just want to clean the pen, you want to wipe down the entire power cord, even though the power cord, likely didn't touch the patient's face. I hope not. Many times you have it braced or draped over your shoulder or something like that. So it's very important that you're wiping all of that down. We do have sleeves you can purchase from MDPen if you would like to have a sleeve on your pen to help protect it as well. But definitely make sure that you're wiping that device down before you put it away and that you're using the proper tools. This is not a device that is autoclaved, so it's up to you to do the cleaning. So make sure you are doing that. I've already done a lot of content this month on using the proper skincare post microneedling, but this is also for safety. So absolutely, once you have created those micro channels using MDPen's Ultra Glide serums as your treatment glide, you want to be using the correct products at the end of the treatment and also sending the patient home with products that are also going to be nourishing, hydrating, non-allergic, safe for their skin. So that's also going to be very important. And, of course, teaching safety that way. All devices are different. With MDPen, you have an adjustable depth dial, an adjustable speed dial, and we are going to teach you the proper depth based on skin thinness or thickness, and also the best depth depending on the area of the face or the body that you're treating. So there's a lot of things that go into it: thin versus thick skin, area of the body that you are treating, and then condition that you're treating. Is it anti-aging? Is it hyperpigmentation? Is it a scar? Is it a stretch mark? Is it hair restoration? So these are all things that you need to consider, which is why, again, it's good to have the hands-on training, definitely going about the proper safety there as well, knowing your contraindications. This is a direct link for training information with MDPen. I hope you can check it out. And even if you've, purchased a different device, we have virtual trainings as well, where we can still, train you. If you're not ready to trade in your device or buy a new device, you can still be trained that way as well, virtually, and have that confidence. And I'm also happy to announce that MDPen will be holding a series of workshops this year in 2024. This is for licensed professionals, and we will cover everything from MDPen and microneedling to NDMed, the RF microneedling system, with all types of radiofrequency handpieces and fractional skin resurfacing. We will cover M-Site PRP at the workshops, and we will cover skincare. So it's going to be really exciting. So stay tuned for that. And these are great. These are advanced users workshops. So even if you do have our devices, even if you have had your initial training with us, this is a great way to get additional experience and meet other professionals in the field, as well as experts in the field. We will have, MD experts there that are medical directors at their own clinics across the country. So it's going to be really fun, really interesting. Again, licensed professionals only. Of course, you can come if you are like an admin within your office, a practice manager, patient care coordinator. If you're coming on behalf of the practice, that's great too. If you're the one making those purchasing, buying decisions for your office. This is a great way to learn more about us as a company and what we offer. So we really look forward to seeing you guys. Bye.